Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'd like to give you an update on the COVID numbers for yesterday. There were 813 locally acquired cases of COVID reported in New South Wales to 8 o'clock last night, and there were 98,266 tests reported for the same period. Across New South Wales, 87.7% of people aged 16 and over have received one dose of vaccine, and 65.2% are fully vaccinated. And the total number of vaccines administered in New South Wales is now 10.2 million. These are great numbers. Thank you so much for coming forward to get vaccinated to protect yourself, your family and your communities. In terms of hospitalisations, there are now 1,005 patients admitted to hospital in New South Wales, 202 who require intensive care and 99 who are ventilated. Sadly, we're reporting 10 deaths of people who have been diagnosed with COVID, 6 men and 4 women. One person was in their 50s, 3 were in their 60s, 2 people in their 70s, 3 people in their 80s and 1 person in their 90s. 5 people were from southwestern Sydney, 2 were from western Sydney, 1 from Sydney's inner city, 1 person from the Wollongong area, and 1 person from the Lake Macquarie area. 4 people were not vaccinated, 5 had received 1 dose of COVID vaccine, and 1 person had received 2 doses of vaccine. The person who had received 2 doses of COVID vaccine was a man in his 60s from Western Sydney who acquired their infection at Mount Druitt Hospital. He had underlying health conditions. And 2 people died at home, a man in his 60s from Sydney's inner city who tested positive following his death and he was not vaccinated. A man in his 80s from the Lake Macquarie area who was being cared for in the community by the local health district. He'd received 1 dose of vaccine and had underlying health conditions. And we'd like to extend our deep and sincere sympathies to the families and loved ones of these people who have sadly died. We've had a number of sewage detections in New South Wales we're concerned about in the regional areas, including Dareton in the far west, Dungog in the Hunter, Karua on the mid-coast, and South Grafton on the northern New South Wales coast, and Bermagui on the south coast. Everyone in these areas should be particularly vigilant for symptoms and come forward for testing should they occur. There are a number of suburbs where we've seen the highest numbers of cases, include Campbelltown, Guildford, Greenacre, Toongabbie, Penrith, Bankstown, Liverpool, Mount Pritchard, Belfield and Merrylands. No matter where you are across the state, it's important to come forward to get testing and isolate until you get a negative test if you have any symptoms at all. Now, it's the NRL Grand Final this weekend, and it's a particular big one for the fans, especially in South Sydney Rabbitohs and Penrith Panthers. And while I hope everyone enjoys the game, I want to remind people to continue to follow the safety rules to keep yourself and your loved ones and your community safe from COVID. Social gatherings are not permitted in homes because you run the risk of spreading the virus. And the number of fully vaccinated adults who can gather outdoors remains limited to 5. There are still high levels of COVID in the community and we need to remain vigilant, even in the face of such an important event for so many people. I want to give you a breakdown of cases in the regional areas. In the Illawarra, there are 72 cases reported to 8 o'clock last night, 49 in Wollongong, 13 in Shellharbour, and 10 in Shoalhaven. On the Central Coast, there were 30 new cases. In the southern New South Wales, 27, including 11 in Queanbeyan and Pellerang, 7 in the Goulburn Mulluwary area, 1 in the Eurobodalla region, and 8 in the Snowy Monaro. In the Hunter, New England, there were 65 cases reported, 25 in Lake Macquarie, 21 in Newcastle, 13 in Maitland, 2 in Port Stephens, 1 in Cessnock, 1 in Mid-Coast, 1 in Muswellbrook and 1 in Singleton. In Western New South Wales, there have been 19 new cases reported, 8 in Burke, 3 Dubbo, 3 in Oberon, 2 in Wellington, 1 in Narromine, 1 in Cowra and 1 in Golgong. In northern New South Wales, 8 new cases have been reported, including 6 in Lismore, 1 in Kyogle and 1 in Casino. There are a further 4 cases reported overnight. These cases will be included in tomorrow's numbers and include 3 in Tweed and 1 in Kyogle. In the Murrumbidgee, there have been 3 new confirmed cases reported, including 2 in the Edward River local government area and 1 in the Albury LGA. In the Far West, 6 cases have been reported, including 6 in Broken Hill. On the mid-north coast, 3 cases were reported, including 1 in Coffs Harbour, 1 in the Nambucca Valley and 1 from Port Macquarie. In the Southern Highlands, 2 cases were reported in the Wingecarribee Shire. Thanks very much. Just a reminder of how important it is to keep vigilant for symptoms, make sure we're all keeping each other safe by maintaining those COVID-safe behaviours, particularly this weekend, even though we might want to celebrate and watch football. It's important we maintain those rules to keep each other safe. And importantly, please come forward for vaccination. Thank you.